Hello, my name is Janak Goel and welcome to my presentation on sacroiliac joint. The sacroiliac joint is a synovial articulation between sacral and iliac auricular surfaces. The interosseous sacroiliac ligament passes between two limbs of auricular surface in the hollow created by the auricular surface. Here is the area of attachment of the interosseous sacroiliac ligament. When the hip bone is articulating with the sacrum, and here is the area with the whole area occupied by interosseous sacroiliac ligament. If you look at the cross section of that view, and here is your ilium and here is the sacrum, here is the interosseous sacroiliac ligament passing between the sacrum and ilium, and the sacroiliac joint lies very deep on the proximal end. Right here you see the sacroiliac joint is very deep up here, but at the distal end it becomes very superficial. Here is the drawing created at the distal part. What you're looking at here is your ilium and here your sacrum, and the sacroiliac joint is very superficial. But if you look at this part, the sacroiliac joint is very deep. Here is another ligament called posterior sacroiliac ligament, which runs downwards and medially from the posterior superior iliac spine to the sacrum and is located behind the interosseous sacroiliac ligament. The interosseous sacroiliac ligament, which is between these two bones, between the sacrum and ilium, whereas the posterior sacroiliac ligament runs behind that interosseous sacroiliac ligament. The knowledge of surface landmarks is extremely helpful in sonographic examination and management of the SI joint. The posterior superior iliac spine is an important landmark which lies on the center of the SI joint. The location of the posterior superior iliac spine on the surface is marked by sacral dimples, which is located about 5 centimeters from the median plane. And another important landmark for the evaluation of SI joint is sacral hiatus. On the surface, the atrial cleft marks the location of the sacral hiatus. Well, this is how I scan for the SI joint. What I do is I identify the sacral hiatus by scanning over the atrial cleft, and then I shift my transducer laterally, and at this point I am in the graded sciatic foramen on the piriformis. Then I shift my transducer proximally till I reach the SI joint, and the SI joint becomes visible. If you look into this video clip, what you will be seeing, the transducer is first shifted laterally and then is shifted proximally, and then you'll see here is your SI joint which is coming up. For the sacroiliac joint injection, the patient lies prone with a pillow under the pelvis. Sacral dimples and natal cleft are exposed and identified. The site of needle entry is marked slightly proximal above the natal cleft, and the one end of the transducer is placed slightly below the sacral dimple and the other slightly proximal to the natal cleft at the point we just marked, and the needle is then inserted at this point and directed laterally in the distal part of the SI joint. If you're seeing that needle is directed laterally from just above the natal cleft into the SI joint. You see this video clip, you see that the injection going into the SI joint has the SI joint being injected.